A perforated ulcer is something we don't see as much of these days with the advent of new anti-acid medications. It's a very serious condition where a hole or an ulcer develops in the stomach or in the intestine, and the contents leak out into the abdomen. This can make you quite ill, or you get inflammation from something. Ibuprofen can cause it, bacteria can cause it, stress can cause it. Some people secrete abnormally high amounts of gastric acid. That can cause it. And for whatever reason, in a particular part of the stomach or the GI tract, this will begin eroding until eventually it actually just pops through and a hole develops between the inside of the stomach and the outside.
The most common symptoms are waking at night with upper abdominal pain or upper abdominal pain that improves with eating. The pain is often described as a burning or dull ache. Other symptoms include belching, vomiting, weight loss, or poor appetite. About a third of older people have no symptoms. Complications may include bleeding, perforation, and blockage of the stomach.
And it's very easy to detect. You can detect it by doing special tests. Some people will check for the H. pylori, physicians obviously, and the stool. If it's there, it's a positive result. The blood tests are not that specific because you may have been exposed to an H. pylori infection many years ago. Your blood is positive, but you may not have active infection at this time. So there are other tests which are non-invasive. We call them breath tests, where you drink something that's usually sweet, and then you breathe into a little bag. And if there's H. pylori that's alive in your stomach, something is released from that sweet mixture that the patient swallowed, and then it's measured in the bag. And if there's an increased release of that something, that tells us that there's active infection with H. pylori bacteria.
When ulcers perforate and are left untreated, these can actually lead to death through widespread infection throughout the body. So these are diagnosed usually clinically. Very often CAT scans and x-rays are not required. It's a very obvious diagnosis to pick up on, and it requires a large, rapid operation to control the leakage from this ulcer. Generally, this is a midline incision with exposure of the abdominal contents. The ulcer is visualized and is repaired with a variety of techniques that we have. The patient often will stay in the hospital for several days afterwards before we allow them to drink liquids and eventually move on to solid foods.
Bleeding occurs in as many as 15% of people. Common causes include the bacteria Helicobacter pylori and non-steroidal anti-inflammatory drugs, NSAIDs. Other less common causes include tobacco smoking, stress due to serious illness, Brexit disease, Zollinger-Ellison syndrome, Crohn's disease and liver cirrhosis, among others. Older people are more sensitive to the ulcer-causing effects of NSAIDs.
Gastric ulcers can often be controlled with drugs that limit or reduce the production of stomach acid. It's also important to reduce the amount of H. pylori bacteria in the stomach if it is present. This is usually accomplished with various types of medicine. Sometimes surgery is necessary if there are complications like a gastrointestinal blockage or if a perforation has occurred. It's important to follow your doctor's instructions carefully after you've had a gastric ulcer. If you don't, there's an 80% chance the ulcer will reoccur within 1 year.